25-year-old woman is undergoing a nephrectomy in order to donate her kidney to her older sister, who has renal failure. The surgeon accidentally cuts a vein draining into the inferior aspect of the renal vein on the side of the kidney which is to be removed. What is the most likely identity of this vein? A. Left ovarian vein. B. Left suprarenal vein. C. Right ovarian vein. D. Right suprarenal vein. E. Splenic vein. Please pause or re-listen to the question before moving on. The correct answer is A. Left ovarian vein. The main explanation here is that the left ovarian vein, or in men the testicular vein, enters the inferior aspect of the left renal vein. The left suprarenal vein also enters into the left renal vein, but it is the superior aspect. The right ovarian vein and right suprarenal vein drain directly into the inferior vena cava. The splenic vein joins with the superior mesenteric vein to form the portal vein. Of note, in kidney transplantation, the left kidney is usually preferred because the left renal vein is longer than the right renal vein. The left renal vein has to cross over the vertebral column in order to get to the inferior vena cava, while the right does not. A patient presents to your clinic with a complaint of visual difficulties. On physical exam, you notice that when the patient looks to the left, only her right eye moves. The rest of the exam is within normal limits. The nerve responsible for this patient's problem travels through which of the following structures? A. The internal auditory meatus. B. Foramen ovale. C. Foramen rotundum. D. Optic canal. E. Superior orbital fissure. Please pause or repeat the question before moving forward. The correct answer is E, the superior orbital fissure. The main explanation here is that this patient in the question stem presents with a lateral rectus palsy on the left side. The nerve responsible for this muscle is the abducens nerve, which is cranial nerve 6. Due to its long path, this cranial nerve is the most susceptible to injury. During its path from the brainstem to the extraocular muscles, the abducens passes through the superior orbital fissure. Other nerves that pass here include the cranial nerves 3, 4, and the first branch of the fifth nerve. The second branch of the fifth cranial nerve passes through the foramen rotundum, while the third branch of the fifth cranial nerve passes through foramen ovale. The optic nerve, the ophthalmic artery, and the central retinal vein pass through the optic canal. Cranial nerves 7 and 8 pass through the internal auditory meatus. A 15-year-old boy presents to your office complaining of a painful mass on the right side of his neck for 1 week. Last week he had a sore throat and productive, non-bloody cough, which has since gone away. He has noticed that the mass usually becomes painful whenever he is sick with a sore throat, but it is never completely gone. He appears anxious because he cannot remember the last time the mass was not present. On physical exam, the mass is immobile and slightly painful to touch, and his oropharynx is clear. What is the likely etiology of this patient's mass? A. Bacterial abscess. B. Ectopic thyroid tissue. C. Incomplete involution of brachial cleft 1. D. Incomplete involution of brachial cleft 3. E. Neoplasm. Please pause or review the question before moving forward. The correct answer is D. Incomplete involution of brachial cleft 3. The main explanation here is that this patient's complaint is likely due to a brachial cleft cyst due to the incomplete involution of brachial cleft 2, 3, or 4 during the 7th week of embryonic development. Because they are lined with ectoderm, incomplete involution leaves behind an entrapped epithelial-lined cyst, which may persist into adulthood, existing as a painless lateral neck mass, only painful during infection. Answer choice A, bacterial abscess, would present with a more dire physical exam, perhaps draining pus, and a patient with febrile illness. Answer choice B, ectopic thyroid tissue, may be found at the base of the tongue or as part of a thyroglossal duct cyst, both of which are ruled out by a normal physical exam. Incomplete involution of brachial cleft 1, answer choice C, would lead to a disruption in the external auditory meatus, the normal derivative of cleft 1, but would not result in a cyst. Neoplasm of the lymph node, answer choice E, is unlikely given the chronic nature of the cyst and the lack of other symptoms of lymphoma. Brachial cleft cyst can be identified through fistulography. A 19-year-old female presents to your clinic for a sports physical before trying out for her college water polo team. During the physical exam, you note that flexing her hip against resistance shows a 5 out of 5 muscle strength. What muscle and nerve roots are being tested in this position? A. Gluteus medius, L4 to S1. B. Iliopsoas, L1 to L4. C. Obturator externus, L2 to L4. D. Semimembranosus, L5 to S2. Please pause or review the question before moving forward. The correct answer is B. Iliopsoas, L1 to L4. The main explanation here is that hip flexion is controlled by the iliopsoas, which is innervated by L1 to L4 nerve roots, and mostly by L2. While the other answer options are all paired with the correct nerve roots, none are involved in hip flexion directly. The semimembranosus extends the thigh while flexing and internally rotates the leg. The obturator externus is involved in leg adduction. The gluteus medius abducts the hip. The major takeaway here is that hip flexion is controlled by the iliopsoas, which is innervated by the L1 to L4 nerve roots, and predominantly by L2. A 16-year-old Caucasian boy presents to the clinic with complaints of anosmia. He has normal GnRH levels and sperm production. Upon full review of his symptoms, you discover that he was involved in a violent altercation with one of his classmates involving a baseball strike to the skull. Which specific part of the cranium may have been damaged? A. Temporal bone. B. Sphenoid bone. C. Mandible. D. Ethmoid bone. E. Maxilla. Please pause or review the question before moving forward. The correct answer is D. The ethmoid bone. The main explanation here is that cranial nerve 1, the olfactory nerve, is responsible for the special senses of olfaction, smell. It consists of unmyelinated axons of bipolar neurons located in the nasal mucosa, the olfactory epithelium. It enters the skull via the foramina of the cribriform plate of the ethmoid bone. If there was an ethmoid bone fracture, as indicated in this case, anosmia or loss of olfactory sensation could result. GnRH level and sexual function are relevant to differentiate this diagnosis from Kallmann syndrome, which is a genetic condition that can also present as anosmia.